If anyone else walks in, they'll just have to catch up.
Yeah, it's after 6.
Yeah.
Any of you who've had any experience with Medicare knows how complex the system is, and you really need a guide. So our good friend Anthony is going to be your Virgil through the Purgatorio today and point out all the things that you need to know. So without further ado.
Thanks so much. I really appreciate it. Thanks for the introduction. Alfred's actually a client of mine, and as I was saying to a few of you as we were kind of getting settled in here, I've done presentations at the library before, and then of course we had the pandemic and I got away from that, but it is something that I do often. So if you're a part of a group, senior group, or even just individually, and you need more information or want to set up a presentation for people that you work with or a friend or family member, just let me know afterwards, and we'll set that up. So what I'm going to do first is just go through what I handed everyone in this folder. There's a bunch of stuff in this folder. I'm not going to go over everything. A lot of it was just kind of tossed in there as I was getting ready for this. A lot of the carriers that I work with, they send me brochures and packets of information, and recently I've been doing a lot of work over the phone, and I just email everyone everything, and I hate to just kind of throw this stuff away. So I figured, these are all good products that I do work with and offer, so I just put them in the folder for you. What I'm going to specifically go over is the printout where it says what you pay in 2022. This is directly from the Medicare.gov website. So if you want to pull that piece of paper out or pages out, that's what I'm going to be reviewing. The rest of the stuff in the folder, of course, you have my card. Again, if you have any questions or anything afterwards and you want to contact me, don't hesitate to reach out. And then I tossed in just some plan information. I'm not going to get into any specific plan information tonight, but I figured I'd throw some brochures in there. Tonight, our focus is Medicare, how Medicare works, what your rights and entitlements are, what the different plan options are, or Medicare supplement versus Medicare Advantage plan and prescription drug plans. I do all different types of insurance. So you'll see, dental insurance, life insurance. I also do home and auto insurance. So again, not going to get into that this evening, but I am available afterwards if you have questions on that. I threw in choosing a Medigap policy. You might have noticed it's a little bit dated, but this is kind of a summary of everything that I'll go over tonight. And all the information's accurate, except the numbers are a little different, and that's why I printed you off these pages with the up-to-date costs for Medicare A and B. Alfred gave me a nice introduction, but just to kind of finish off the introduction so you know who I am, like he said, my name's Anthony. I'm a local guy. I grew up in Blackwood. I went to Triton High School, went to Rutgers University, and for the past 9 years, I've been doing Medicare supplemental insurance and Medicare Advantage plans for people that are on Medicare, as well as life insurance, annuities, and home and auto insurance. And our office is in Cherry Hill, but I do business all over South Jersey. Basically, what I do that I kind of separates me from just calling the insurance company is I give you an extra layer of customer service. So you're not getting transferred around. You're not pressing 1 for English, 2 for Spanish. You're getting a real live person that actually you've met before and is going to address whatever issue you might be having. I do business in person, over the phone, over Zoom, whatever you prefer. I really appreciate when people are attentive to me and give me good customer service. So I try to, do that every day. So that's enough on me. Let's get into Medicare. Very exciting. I know the moment you've all been waiting for. So some of you may be on Medicare already. Maybe you're approaching Medicare. So what I'm going to go over is the different parts of Medicare. Okay. So we'll start with Medicare Part A. Okay. Everyone gets Medicare Part A when they turn 65, okay? As long as you're a United States citizen and you've worked at least 40 quarters, or your spouse has worked at least 40 quarters, you will receive Part A at no monthly premium, no additional cost. You're entitled to that Part A benefit. With Medicare Part A, what that covers is your inpatient hospital stay, okay? With your inpatient hospital stay, you do have a Part A deductible. Your Part A deductible for 2022 is $1,556, and that'll be an even $1,600 in 2023. Okay, so if you go into the hospital with Medicare Part A, your Part A deductible again is just about $1,600 next year. Medicare Part A also covers your inpatient hospital stay. Excuse me, I just said that. It also covers your skilled nursing care. So if you come out of the hospital, you don't go home and you go to a skilled nursing facility to rehab and get back up onto your feet, the first 20 days is covered by Medicare Part A. So you'll pay nothing for those first 20 days of skilled nursing care, but you will pay days 21 to 100. You'll pay up to $197 per day, or excuse me, $194.50, and then even $200. It's funny, they $194.50 and then it's just 200 in. They always seem to have change on there, but it's $200 for next year. That's days 21 to 100 at a skilled nursing facility. Part A also includes your in-home home health care and hospice care, as long as your doctor determines that that's medically necessary and you need that home health care or hospice care, that'll be covered under Part A as well. One thing I didn't mention is if you do have questions along the way, I'm probably going to answer it at some point. So let's try to hold questions to the end, just keeps it moving. But no one's had any questions so far, so that's good. So that is Medicare Part A. Again, it's covered for your inpatient hospital stay. You have the Part A deductible of $1,600 next year. And then after the first 20 days of skilled nursing care, it's $200 for days 21 to 100. Medicare Part A just covers you for short-term skilled nursing care. So anything longer than that, you would actually need an insurance policy if you wanted coverage for some type of long-term skilled nursing care. So that brings us to Part B. Most people will get Part B when they turn 65, along with Part A. You're not required to enroll in Part B at 65. A lot of people are still working at 65. So if you're still working at 65, or your spouse is still working at 65, and you have health insurance at work, you can defer your Part B until you retire. And then when you take your Part B, whether it's at 67 or 70, whenever you decide to retire and lose that insurance through work, then you'll be taking your Part B benefit and you'll have the full Medicare A and B. You'll have the same rights and entitlements that you do at 65. So with Medicare Part B, what that covers is that's going to cover you for your doctor's visits and surgeries, okay? It's also going to cover you for preventative health care. So things like a flu shot, mammogram, colonoscopy, PSA test, any test or screening that's preventative in nature is going to fall under Part B. So x-rays, physical therapy, blood work, that's all Part B of Medicare. Any type of surgery and durable medical equipment. So things like a wheelchair, walker, cane, oxygen, all that stuff is Part B of Medicare. So with Part B of Medicare, there is a monthly premium. So the monthly premium for most people is $170.10. This is $170.10 each month. That's actually going down by a few bucks to $164.90. So, $5 back in your pocket. Enjoy. Don't spend it all in one store. So that'll be next year, $164.90. That monthly premium for your Part B coverage is going to either come directly out of your Social Security check, or if you don't collect Social Security yet, you're going to be billed for that quarterly, for that $170.10 or $164.90. So that's your Part B premium. Most people pay the $170. Now, you can pay more or less than that dependent on income. So if you're, you know, a high earner, you're going to pay a little bit more. If you're, you know, a lower earner, then, you know, you could pay less depending on where your income is. And I could look that up if anyone had a question on that. But most people I meet with kind of fall, it's a pretty wide window of people that pay the 170. So there is a Part B deductible for those services that I mentioned. So your doctor's visits, surgeries, durable medical equipment. The Part B deductible is $233. And again, that's going down next year to just $226. So next year, the deductible will be $226. You'll pay that deductible each year. And once you satisfy that deductible, it's an 80-20 split. So Medicare is going to cover 80% of those services I mentioned under Part B, and 20% is the gap. So 80% of your doctor's visits, surgeries, medical equipment is covered by Medicare, and then 20% would be your responsibility. That's probably the most concerning gap in Medicare. Of course, you have the Part A deductible, which could pile up if you have a number of hospital stays. But 20% of something could be a very large number. Of course, if you have heart surgery or something like that, could be a lot of money. So that's where the Medicare supplement plan comes into play, which I'll go over next. So that is original Medicare, Medicare A and B. That got started a little over 50 years ago and has been pretty much exactly the same. The plans that I'm going to discuss, like Medicare prescription drug plans and Advantage plans, have come about more recently. But original Medicare Parts A and B has been around for a long time. And the costs have come up, but the structure of it has pretty much stayed the same, or has stayed exactly the same. So I mentioned a few gaps in Medicare, of course. Your Part A deductible at the hospital, your Part B deductible, and your Part B 20% coinsurance. So what I do as an insurance broker is I am contracted with the various insurance carriers that offer Medicare supplement and Medicare Advantage plans and prescription drug plans. So that's what I'll touch on now. First thing I'll do is go over the Medicare supplement plans. These are also known as Medigap plans, just two different terms, the same thing. So there's actually a chart. It's the last page in the stapled papers that you have there. Okay. So this chart is a chart of the Medicare supplement plans or Medigap plans that are available from many different insurance companies. Couple things about Medigap plans. So these plans are standardized by the government. So if you have Plan G, for example, and your neighbor has Plan G, you have the exact same plan, benefit for benefit. All the coverage is exactly the same. The only difference is the price that you pay for it. Okay? And that's part of my job as an insurance broker, is taking a look at the various carriers and saying, okay, you know, this company has it for $150, you know, that's the lowest rate in your area, maybe we should go with that. With a Medigap plan, it's going to do just that. It is going to fill the gaps of Medicare that I mentioned, or it's going to supplement Medicare as your secondary insurance. So Medicare A and B is your primary, and then the Medicare supplement is the secondary insurance that would fill those gaps that we talked about. If you go to the hospital or doctor's office, you would present both the Medicare card and the Medicare supplement card. With these plans, if you have a plan like this, it fills those gaps. A couple things it doesn't do is it does not give you the drug coverage. That's going to come in a separate standalone prescription drug plan. And I'll talk about those in a minute. And also, it doesn't include any dental, vision, or hearing. So things that are medically necessary, like diseases or conditions of the eye. So if you have like glaucoma or you need cataract surgery, that's going to fall under Medicare. but money towards eyeglasses, dental work of any kind, and money for hearing aids, that's not included in the Medicare supplement plans. You can get a separate plan to pay for those things. So looking at this chart here, it's a little bit confusing. Across the top, you see a bunch of letters. They didn't get very creative with the plan names, but I'm just going to go over a handful of these plans. I'm not going to go through each and every one. I always go over F, G, and N. I actually don't go over F as much as I used to because it has been discontinued. Anyone that's turning 65 now is not eligible for Plan F, but I mention it because it is available to people that turned 65 before January 1st of 2020. So it is still available for those people. Plan F, pretty simple one to review. It's going to fill every single gap that I mentioned. So it's going to pick up the Part A deductible, the Part B deductible, and the 20% coinsurance. It's the only plan that covers the Part B deductible. And Plan F for a while was a very popular plan, but also it's the most expensive plan. And especially now that it's been discontinued, it tends to take a steep rate increase year over year. So I usually don't recommend that one, especially since many people I meet that are turning 65, they're not even eligible for that one. So the most popular plan, the one that I always suggest to everyone or recommend, is going to be Plan G, okay? That is very similar to F. The only difference is with Plan G, you do have to pay your Part B deductible. Your Part B deductible, if you remember, is $233. That's for this year, and then next year it's $226. So once you pay that deductible, after you have a couple doctor's visits or you need surgery at the beginning of the year, once you pay that, that's your only out-of-pocket cost for the rest of the year. Okay, there's no co-payments, there's no further cost when you have Plan G. Your hospital is covered at 100%, and your Part B coinsurance is covered 100%. So I like that plan. It's the most comprehensive plan that you could get. And it's unlike Plan F, it's a little bit cheaper on the premium because you're not overpaying for the plan just to cover that small deductible. So that's Plan G. The last plan that I'll mention is Plan N. That plan is, again, similar to G. The difference is you have a couple co-payments. So it's a $20 copayment at the doctor and a $50 copayment at the ER. That's waived if you're admitted. That $20 is at any doctor's appointment. So if you have doctor's appointment with your primary care physician, specialist, or if you have a physical therapy appointment, you could get dinged for that $20. So often when people are trying to decide which plan might be best for them, I always ask them, well, how often do you go to the doctor? And then I also remind people a lot that as you get older, you're more likely to go to the doctor more. And when people choose a plan, you can change your plan. You're not, married to it, but often people keep the same plan for a while. So whatever plan you choose, you could have it not just for the next year, but you could have it 10, 15 years from now. Regarding getting onto the plan and changing plans. So at 65, or when you take Part B for the first time, so that's when you turn 65, or if you waited to get your Part B because you were still working and you took Part B at 70, in those both situations, there are no health questions for the plan. So you choose whatever plan you'd like, you're on that plan, and the plan is yours. They're never going to kick you off the plan for anything that happens health-wise, or jack up the premium or anything like that because of the amount of claims made. The premium will rise kind of steadily each year as you get older. Usually across the board, it's about 3 to 5% increase year over year. But I've seen some people go 12, 18, even 2 years, 12, 18 months or 2 years without a rate increase. So that's possible too. If you get onto a plan and you would like to change it in the future, once you're outside your initial enrollment period when you turn 65, let's say 2 years later you come to me and say, Anthony, you know what? I took Plan N with, United Healthcare, but now I want Plan G with Aetna. No problem at all. But I'm going to have to ask you the health underwriting questions. So I'm going to say, well, have you had cancer, heart attack, stroke, diabetes, things like that. So that could affect you getting onto a new plan. So you might be, depending on your health, kind of stuck with the plan that you have. Again, that's not going to be taken away from you, but you wouldn't be able to switch to a new plan that you wanted to go to. So those are the Medicare supplement plans. Again, I went over F, G, and N. The rest of the plans are basically some variation of that. Plans like K and L and M are similar to those plans, except they just have less coverage for the things that I mentioned. They cover, instead of 100%, they cover 50% of your hospital or 75% of your hospital. Insurance, simple way to, always understand it is, if you lose a little bit of coverage, you're going to save some money on premium. If you want more coverage, it's going to be more expensive. So that's how a Medicare supplement plan works. And if you remember, that doesn't cover the prescription coverage. That doesn't include prescription coverage. That would come from a standalone prescription drug plan. So all these prescription drug plans are offered by the same insurance carriers. These plans, again, they have to be approved by the Centers of Medicare and Medicaid Services and have to meet a certain standard, okay? They will all have a long list of drugs that they cover, called a formulary. And those drugs are tiered 1 through 5 with every plan. So your tier 1 generics, your things like statins, levothyroxine, common, blood pressure and cholesterol meds, things like that, lisinopril, that stuff is going to be $0, $1, $2. Tier 2 generic prescriptions could be $5 or $10. Once you get to tier 3, those are going to be brand drugs. Those can be $40 to $50 for a 30-day supply is what I'm, for a 30-day supply. And then if you're getting to tier 4 drugs, if you're taking, brand prescriptions, those are going to be more expensive. You're talking about $100 for a 30-day supply or 25% of the drug cost if it's like a tier 5 specialty drug. So with the Medicare Part D plans, they all actually have the same payment periods or payment phases throughout the year. Most plans will have a drug deductible in the beginning of the year. So next year, the highest the deductible can be, and the deductible that most plans have is $505. Meaning that, let's say I took Eliquis, it's a blood thinner. That drug, I'm gonna have to pay the full retail cost of that drug until I hit $505. Then I'm gonna fall into what's called my initial coverage limit, okay? During my initial coverage limit phase, I'm paying a fixed co-payment that's gonna be lower, okay? For that particular drug, for a lot of plans, the co-payment's like $40, $47 for that one. You are in that initial coverage limit from that deductible until you hit around $4,500 of true out-of-pocket cost. So what true out-of-pocket cost is what you have paid for the drugs and what the plan has paid for the drugs. So it seems like a very high number, but it's not just what you've paid, it's also what the plan has paid. Once you hit that number, which again for the plans is about $4,500, you'll fall into what's called the coverage gap. Another term for this is the donut hole. During this payment phase, the cost sharing is going to shift. So instead of you paying that co-payment for the drug, you're going to pay a co-insurance, which is a percentage. So you're going to pay 25% of the full drug cost. This sometimes results in you paying more for that drug during that coverage gap phase. Once you hit over $7,000 of true out-of-pocket cost, that's going to result in you falling into catastrophic coverage, where actually the cost of this prescriptions is going to go down towards the end of the year if you fall into catastrophic coverage, and you're only going to pay about 5% of the total drug cost. The drug coverage is usually the trickiest part to explain, especially if someone's taking a lot of prescriptions. What makes it a bit easier is if I'm on an appointment with someone, whether it's on the phone or in person, I put their drug list into a plan finder. Medicare.gov, that's actually where I printed off this stuff at. I'm going to put that right into the Medicare website, and it's going to give me a list of all the drug plans that are available, and it's going to tell me exactly what those drugs are going to cost throughout the year. It'll total up the co-payments for all the drugs. It'll give me the premium for the drug plan, and I will go line by line with people to kind of explain, okay, this is what this is going to cost, this is what that is going to cost. So it gives you something to kind of reference. And then each year, an important thing to remember, if all of that was a little bit confusing, the only thing you need to remember is that the annual election period for Medicare prescription drug plans and Medicare Advantage plans is October 15th to December 7th, okay? So that is actually where we're at right now. It's a window each year where you can shop the different plans. So when you enroll in a drug plan, that's your plan for the following year. If I sign someone up for a drug plan today, their plan starts January 1st, goes all of next year, and then during this time again next year, anyone I talk to, gets an email, hey, it's that time of year to review your drug plan. The drug plan may have changed. They often do. Drugs come on and off the formulary. The premium can change. Your drug list may have changed. So it's a good idea to review that each year, and this way you can save yourself some cost on prescription coverage. So that's how the prescription plans work. Last thing I almost forgot to mention is, what if you're not taking any prescriptions? Why would you want a prescription plan? So if you don't enroll in a Medicare Part D plan when you're first eligible for Medicare A and B, and you decide to enroll in one 5 years later when you're prescribed some kind of drug, you actually incur a penalty for the time that you went without a drug plan. I didn't make up that rule, but
That's crazy.
Yeah, so that is kind of one of those rules, bit of a head scratcher. I guess it's kind of to encourage people to enroll in a plan.
And pay money.
Yeah.
Rip us off.
It's all a
one
bunch
more
of
time.
yeah. They get you coming and going, but it's not a huge penalty, but it's kind of a annoying one because that penalty is going to stick on to your drug plan for the rest of the time you have one. So I always tell people, get the drug plan. This way you have it, you avoid that penalty, and if you get prescribed something throughout the year, you have the drug plan to help you pay for it.
Yeah, but if you're paying more money for the drug plan than you are to get the prescription.
Yeah, I mean, the drug plan is not mandatory by any means. It is voluntary. Like I said, I always suggest people get it, but it depends on what you're taking. If you're taking just a couple, generic prescriptions, those are going to be $0. At the end of the day, you're probably breaking even. If you are taking some serious meds and then they're brand prescriptions, it's definitely going to help if you have the drug plan. So the drug plan in that situation is by itself. The other type of plan that you could have includes the drug plan. So when you have Medicare A and B, you could either go the route that I just reviewed, the Medicare supplement with the standalone prescription drug plan, or you can do what's called a Medicare Advantage plan. This is also known as Part C of Medicare. Notice the theme, everything has multiple definitions, or there's multiple names for this stuff. But Medicare Part C, they call it that because it includes your benefits for A, B, and D. So it's going to kind of rope all those benefits into one plan for you. These Medicare Advantage plans are going to be HMOs and PPOs, and how they work is a little bit different. So in the first situation, you had Medicare as your primary, and then the supplement filling in those gaps with a standalone prescription drug plan. With original Medicare and the supplement, there's no network of doctors. The monthly premium you pay for the Medicare supplement, for most of them, it's going to be over $100 on the monthly premium. But you're not paying co-payments for your doctor's visits, surgeries, medical equipment, and so forth. When you have a Medicare Advantage plan, kind of just works the other way around. You're actually not going to pay much for the plan. The plan itself starts out at $0 per month, so you do not have monthly premium. Sounds pretty awesome. So you do have a $0 monthly premium for most plan options in the area. There is a network of doctors. So unlike the Medicare supplement, there is a network of doctors.
Sorry.
I'll take it away next time. That's what the teachers used to say to us. So there is a network of doctors. Now, anytime I sign someone up for a Medicare Advantage plan, the first thing I do is check to see if their doctors are in the network. If you ever get someone trying to get you to sign up for a plan without looking up your doctors, don't sign up for it. You should always look up the doctors. You know, I got a list of 10 doctors the other day. Looked all 10. With most of these plans, they have a pretty strong network. Any plan that I suggest to someone, I have a couple carriers that are kind of top of my list that I know has a strong network. So that's usually not an issue. And the last thing that a lot of people like about these plans is they do include some dental, vision, and hearing coverage. So they'll include money towards dental, usually $1,000 to $2,000 towards dental. They'll include preventative dental, $100 to $200 towards eyeglasses, and even money towards hearing aids. Sometimes they have a fitness benefit and meals after the hospital, things like that. Sometimes they include over-the-counter benefit that you can use at the pharmacy for vitamins and so forth. Now that is all good, and that's what you see a lot on the commercials for these plans. If you guys have seen those, that Joe Namath's on the one, he's like, call now, If you've ever called that number, you just get routed to someone like myself. But basically, that's all the good stuff. And it's not, I think the commercials for these plans from the carriers and the other commercials, the general ones, are a little bit misleading. But they do have $0 premiums and they do include those benefits. What they fail to mention on a lot of the commercials is you do have co-payments for your medical services. So with the supplement option, you don't have to pay for your surgery. You don't have to pay for your hospital stay. When you have an Advantage plan, you're not paying for the plan, but if you have an inpatient hospital stay, that's going to be one of your higher co-payments. So you'll pay around $400 per day for days 1 through 5. You'll pay $90 for the ER, $350 for surgery, so on and so forth. Some of the co-payments are minimal. You could pay as low as $0 for your primary and $20 for your specialist. So that's not too bad. But what I always caution people of is, keep in mind that if you end up in the hospital, you're going to have this co-payment. Could be $1,000, $2,000, $3,000. Now they do cap you, so you're not in a completely catastrophic situation. They have a maximum out of pocket for the year, which is usually around $8,000 for most plans. So that's still a lot of money, of course. So if you have some kind of chronic condition, could possibly hit that. But that is the only real turn off for the Advantage plan. It's really a matter of preference. I have people of all different backgrounds, income levels, choose either plan. I always just kind of like to lay it out like I did this evening and let people pick whatever works for them. If someone's already in bad health, I tell them, get the supplement, especially if it's, during your initial enrollment period, because you're going to use the plan. If someone's like a marathon runner or something, I don't really fault them for wanting to, hey, I'll take the cheap plan and I have a couple dollars saved up if I end up in the hospital. and the drug plan will be included on that Advantage plan as well. So that's how the Advantage plan would work compared to the supplement. That's all the information that I have for you. I know I went through that pretty quick. I mean, it's a lot of information to get through, but I didn't want to keep you guys too long. I actually ran longer than I wanted to. But that is original Medicare, how a Medicare supplement works, how Advantage plans work. I'm going to open it up to any questions that you guys have. So go ahead and fire away, and I'll answer them the best I can.
What if you are allowed to continue with your employer's healthcare plan when you reach 65, and then you don't retire till you're 67?
Sure.
But you're still allowed to be covered under your employer's healthcare plan.
Yeah.
It's a federal government, and they employ more than 1,000.
Yeah. So if you're covered through work, you can keep the work coverage for as long as you're still working.
Right.
And then if you retire and you lose the work coverage, at that point, you would contact Medicare and say, all right, I'm going to enroll in Part B. They'll send you an updated card.
Okay.
In certain situations, it really varies on what people's work coverage is. Some people have excellent coverage at work, usually if it's a larger company or if it's some kind of government job. Those people, a lot of times, they might have benefits after they retire.
Correct.
So they're people that I typically, teachers, for example,
Right.
I don't really talk to a lot of teachers because they're like, hey, I'm good, I got the NJEA benefits or whatever. So I don't, there's nothing I can really do extra for them in those situations. But yeah, you would just take it as soon as those benefits stop, you would pick up the Part B.
Right.
Could I just say something
Yeah.
in response? I was in a situation where I was still working full-time at a library and I had my insurance and I was about to take Medicare, so I knew it would change. I thought I had to wait until October through December to make the change.
Sure.
And you have to do it right away, and I found that out in retrospect, so I have
Right.
one of those lifelong penalties now.
Right.
It's not a lot of money, but
Right.
if someone, like Anthony, I had gone to one of his sessions, I would have known that.
Right.
And avoided that, so it's well
Right.
worth it. And even when you're working full-time and you have coverage, they still will take out for your Medicare. Is that correct? Because when I was at,
If you enroll, so there's a late enrollment penalty for the Part B if you don't have what Medicare deems credible coverage.
Right.
What I would do if I'm approaching 65 is you can contact Social Security either online, over the phone, or you make an appointment at the office. I don't believe they're doing the in-person still.
No, they
because-
are.
They are? Okay.
Yeah.
All right. So whatever you prefer. Not probably gonna be the funnest visit. I would schedule like lunch afterwards. But you go in there, you give them your situation. It's arranged. Sometimes I've heard they've been very helpful. Sometimes seems like it's the person's first day, but they'll be able to let you know. Okay, yeah, if you're still working, just this is your card for Part A. Well, they're not gonna hand it to you right there, but they'll get you a card sent out for Medicare Part A benefits only, and then they'll let you know, just to contact them again when you're getting close to retiring. In that situation, yeah. Other questions, concerns, comments?
yeah, this is your chance, folks. If you have a question, please
I
ask.
have a question.
Sure.
If you're a vet and
Yes.
you're using the veterans
Mhm.
facilities, hospitals, whatever.
Yeah.
What do you recommend for that?
So, there are some Medicare medical only benefits plans that are kind of specifically for people in that situation, veterans. Because a lot of times people who have VA benefits will get the prescriptions from the VA. But what the insurance companies do is they offer medical only plans that will include some dental, vision, and hearing, and it's a $0 plan. So it's kind of just a perk for being a veteran. Doesn't cost you anything extra. It's not going to affect your VA benefits. It's just extra coverage that you'll have in the case that you can't make it to a VA doctor or you would like to go elsewhere.
Well,
Yeah.
now they have where if you can't get in to see the VA, and you do go elsewhere, they will still pay.
It's just to be covered. Okay. Yeah, I mean, it really depends on your preference. I mean, some people will tell me, well, hey, listen, I have the VA, I don't really need anything, and that's
Well,
fine. But then
that's
some
not
people,
true.
yeah, then a lot of people they'll say, oh, I have VA benefits, but I'm not really happy, or I gotta wait, or whatever it is. I've never been in that situation, so I'm not sure. I'm just basing this on people I've talked to. So I usually suggest, okay, you can get Aetna has ones called the Aetna Eagle Plan, or Humana has one called Humana Honor Plan, and they're geared towards veterans because they just include extra medical benefits and they don't cost anything. And like I said, it's not going to really affect any other coverage, so you could try it out, and if you feel like you're not using it, you could disenroll after a year or something.
So the best way to go about that would be to go to the VA and actually ask them what's covered. My husband's a veteran,
Mm-hmm.
and he turns 65 next year, but he's playing tennis tonight, so here I am. Anyway.
I hope you took good notes now.
So-
Yeah. Yeah, I mean, he could take one of those plans that I mentioned, or he doesn't have to. I tell people it's free. I mean, the plan doesn't cost anything, so I would take advantage of it. It's extra dental coverage if you'd like, money towards eyeglasses. They have over-the-counter benefits, so it's there if he wants to enroll in something like that. I don't think the VA would tell him not to. You know what I mean?
Yeah.
It just keeps your options open, basically. Yeah.
I know my brother has the Medicare and also does the VA,
Uh-huh.
and he had some kind of procedure done that they didn't do at the VA.
Okay.
But when they sent him out to have it done, the VA paid for it. He
Okay.
didn't have to, I mean, I'm sure they took his Medicare and all that so they could charge whatever they could to Medicare.
Sure.
But
Yeah, I'm not an expert on the VA benefits. So that sounds like it worked out great for him in that situation. So yeah, I mean, you could enroll in one of those plans, or you just keep the VA benefits and see how the care is with that. Yeah.
I have a question. Medigap plan N.
Uh-huh.
Ballpark as the monthly.
Sure. Yeah, about $100. Yeah. So the plan price, I don't give out a ton of plan prices, but I hate when people are like, I'm not gonna tell you, haha. So I'll throw some ballpark numbers. So if you're turning 65, plan N is gonna be around $100. Plan G is gonna be around $160. Now, those rates go up as you get older. So if someone's 70 and they're getting plan N, instead of $100, it's going to be like $130, $40. Like I said, the plans take an increase about 3 to 5% each year. The rate is affected if you are a smoker. The rate will be more expensive. And then also male guys will pay a little bit more than female on health insurance.
why is
But
that?
I guess you guys are just healthier than us. We're just
We die
taking
earlier than
taking
you
more
do.
risks
We
and
get sicker.
drinking, smoking, and
That's right.
stuff like that. I don't know, eating cheeseburgers too much.
Yeah, 'cause we women don't do that either.
Yeah.
Never.
No, not you ladies.
Never.
No. But yeah, that's just one of those things. Yeah. What I do is, when I sign someone up for the plan, basically I get a notification whenever they get an increase, and usually if you're paying $100, maybe the next year your monthly premium is $108. And if it goes up $20 or $30, that's when I'll call someone and say, hey, let's look at some different options, maybe.
Well, that's pretty much with insurance across the board. Like, men will pay more for
On the car insurance, yeah.
Than
Yeah. Yeah.
even first time drivers,
Mm-hmm.
guys.
Yeah.
Why is
Sure.
that? Seems how you work in the insurance company, why is that?
I mean, all these insurance companies have, thousands of actuaries and accountants and really smart people that look at a bunch of statistics and basically determine, hey, 17-year-old kid getting his license, that's going to be more expensive, or guys, they're going to need more health care than women at X age or whatever. You know what I mean?
I get it back in the day, but women are working just as much as the guys are now.
Sure.
So they're driving just as much to and from work, and I don't get why it's more expensive.
Yeah, I mean,
back in the day, when, we were all housewives.
Yeah.
And
now they have the Real
I get it,
Housewives. Have you ever
but-
seen that show?
Yeah, well.
My
They
wife
don't-
watches that one.
They don't
not
do their own
housewives.
driving.
Yeah,
They do
yeah,
not
yeah.
do their own driving.
Yeah, I mean, the insurance companies, like, just to kind of, I guess, wrap up. I mean, you guys can keep asking questions, but, the insurance companies, I work for all these carriers, all companies you've heard of: Aetna, Cigna, Humana, United Healthcare, and the list goes on. Basically, they're all about the same. They're good company. They're A-rated companies. They're going to give you the coverage, but you are policyholder XYZ397 or whatever it is. I don't have as many clients as they do, so my job is to basically be there to answer questions and so you can avoid hold times. And if I can save you 10 minutes of being on hold, then that is just 10 minutes that you have back to do whatever you like. And if I can save you a few dollars, that's my goal. That's what I'm trying to do, because, grocery bill is a bit high and everything like that. So, my job is saving people money and working for you, not working for the insurance company. It doesn't matter to me who people enroll with. I all get paid pretty much the same. It doesn't cost you anything extra to get enrolled through a person like myself. The insurance company pays me directly to get you the information and then service your plan. So that's kind of how my job works. And yeah, with the insurance companies, they're just like all the big corporations out there. They're they providing a service, but they're trying to make money. Which hey,
They make money.
I
They make money.
yeah, they make a ton of money. They do.
No doubt.
It's nuts. But my small part that I play is, helping out my clients.
Are you better off sticking with one company for years and years and years rather than jumping around?
Not really. So going back to kind of the
Nothing
point I
like
just made,
loyalty?
there's no loyalty.
Nah,
I mean, this is kind of just general advice,
they
but
don't care.
if you switch stuff all the time is when you get the deals. You know what I mean? Like, if you go back and forth from Verizon to Comcast, that's going to be a huge pain in the ass, but it'll probably save you a few bucks. So, you know what I mean? So if you switch companies, that's when you're going to get better rates. Now, a lot of people don't like switching in general. It's, I don't want to do all this stuff. I handle the paperwork, and it's not even paperwork. It's just 10 minutes on my computer. So I don't mind switching people. What I found is once I sign somebody up for a plan, if it ain't broke, they don't want to fix it. So if their rate has stayed relatively the same and they've gotten good care, they didn't have any billing issues, they'll keep the plan. But by you staying on the same plan for years and years and years, there's no benefit to that. In fact, I would say I would avoid that.
Why?
Because they'll just move the rate up on you each year. Not necessarily with the health insurance, but other types of insurance like the property casualty stuff. People are like, I've had, so-and-so for 100 years, not 100, but I've had them for a long time. They don't care. They're going to increase the rate on you. And, if you go to another carrier, you shop around, you do your shopping, you can find a lower rate typically. So no loyalty discount.
And you're saving money by changing your
They
insurance
do,
company. You're getting maybe getting bonuses that you wouldn't get with the one company that you stayed with all those years. So it's worth. It's not that time consuming to do it. It's to your benefit. But I wanted to ask, if someone is on an Advantage plan now because they're not having too many health issues, but are looking into the future when
Mhm.
there may be a time that there'll be hospital stays and
Sure.
surgeries. Is there a transitional age where you should change from Advantage to Medicare supplements?
No, that's all up to the individual. So what I usually tell people is when you turn 65, if you can afford the Medicare supplement, you know, $100 a month, $150 a month, give or take, do the supplement first because you're protecting yourself, your insurability basically. Now, the Advantage plans, I don't think I mentioned this, they don't have the health questions. So if your rate has gone to $250 and you're 75 years old and you're like, I can't pay this anymore, it's easier to fall back to the Advantage plan and roll the dice a little bit. Then it will be to do the opposite and switch to the Medicare supplement. It all really comes down to preference. You know, some people would just say, hey, listen, if I end up in the hospital, I'll have to pay, you know. I'll rather save the money if I can, and then other people would rather have the peace of mind. Hey, I'll pay ahead of time. I don't have to worry about any bills that I don't know about. So it's a pretty close to 50-50 split for me. That probably what plays a factor there is how I present it. I really try to be very middle of the road because I want people to feel like they have they're picking the plan. There are agents that will just tell you, okay, get this plan. It's kind of easier to do that because, if I go over both options, people will hem and haw all day. Oh, what should I do? But it depends how you're kind of pitched the plans. I could spin it either way, but it doesn't really matter to me. You know what I mean?
I'm laughing because that is true. Yeah,
It's true. Yeah, I mean, it does.
You can,
It doesn't matter. Yeah, I can make so. I've met agents before. They're like, oh, all my clients have the Advantage plan.
Right.
And I can understand the argument. But sometimes people are like, well, what if your grandma was on a plan? What would she get? I'm like, well, I would tell her get the supplement, but there's a pro and a con list to both options. The supplement's not cheap. So that factors into it, So I'm gonna wrap it up for the evening, just because I'm sure you guys want to get home too. But I really appreciate Alfred having me out and everyone that showed up tonight. If this information was good, if you have more questions, don't hesitate to reach out. Book an appointment. We can meet back at the library, or I could come to your home, or meet at Starbucks, or just do it over the phone, whatever you prefer. And then if you know anyone else who has questions about this stuff, just pass them my information.
Well, we have a senior thing now from the town that
Okay.
meets once a month.
That's great.
And I'll pass on your card, maybe that you could come and talk.
Yeah, please.
It's
Yeah.
the first Monday of the month?
Ours are there.
No, from this church.
Do you have a few extra folders? Some people couldn't make it.
It's the
tonight.
first
Yeah,
Monday.
yeah.
First Monday, and it's in the afternoon, but
Yeah.
if we could give this card to
Thank
her,
you.
and she could.
Yeah, no problem.
And it's always a pleasure to have Anthony with us. It's always a pleasure to have Anthony with us. Can we have a round of applause? Thank you for gracing us.
Yeah, thanks.
And that too, yeah.
Through my husband's job.
Uh-huh.
He worked for the federal government.
Mhm.
I have insurance for life.
Sure.
I have dental, vision.
It's pretty good shape.
I got
Yeah.
pretty good, and it's really
Yeah,
good.
yeah.
However, do I just, I don't need to apply, I won't be 65 until next December.
Oh, okay.
So like, do I just sign up for Part A and call it a day?
Yeah, that's it. That's all you need.
That's all
Mhm. Yeah.
The supplemental, yeah.
Well, thank you, you just made it so much
Yeah.
easier.
It's the other different.
You work for the federal government, right? Yeah,
Right.
that's what I was
And my
asking
husband
about.
had a policy.